So my presentation today is going to be over canine conjunctivitis, also known as pink eye. And I'm just going to talk a little bit about it and at the end talk about my dog's encounter with pink eye. So conjunctivitis is the inflammation of the conjunctive tissue and the conjunctiva tissue. And the conjunctiva is a mucous membrane, and it's similar to the lining in mouth and nose, and it's a layer of epithelial cells with mucus secreting cells, and it covers the eyeballs, eyelids, and the third eyelids in dogs and any other animals with third eyelids. So to know signs and symptoms, you should know what it looks like in healthy dogs. So usually the conjunctiva is not visible, and it also has a pale pinkish color to it. And if your dog does have conjunctivitis, a sign is visible red and swollen conjunctiva. So some common clinical signs of conjunctivitis include discharge from the eyes, and they can appear either cloudy, or yellow, or greenish in color. You may also notice squinting or excessive blinking, as well as your dog trying to paw at their eyes to scratch it, because it can also be very irritating and itchy. As well as redness and swelling around the eyes. Usually it involves both eyes, but in some cases it may only affect one eye in certain conditions. And also some other signs to look for is nasal discharge, sneezing, or coughing, but those may also be signs of something else wrong with your dog. So conjunctivitis can be caused for many different reasons, and some of those reasons include foreign bodies like irritants getting into their eyes, so allergies can be part of that. So anything from dirt to mold to pollen or any type of debris that gets in their eye can irritate it. It can be from bacteria, or it can also be a viral infection of the eyelids or the conjunctiva, as well as inflammation of the tear duct, dry eye as well, or even more serious problems such as tumors or trauma. So since conjunctivitis can be a symptom of another problem, it's very important to distinguish it from a primary or secondary condition. So in order to do this, a complete detailed ophthalmic examination must be performed to differentiate between the conditions. So this may include an examination of the surrounding eye structures, such as the eyelids, the eyelashes, tear ducts in the third eyelid. A tear production test or a Schwimmer tear production test may be performed, as well as a corneal stain test to ensure that the cornea is not damaged or that there's any trauma to the eye, as well as an intraocular pressure to rule out glaucoma or uveitis, I think that's how that's pronounced. And again, other additional tests and procedures may need to be done depending on what the veterinarian finds when they're doing these examinations. So this can include nasal cranial duct flushing, bacterial cultures, if they suspect it's bacteria, sensitivity tests, biopsies, cytologies, and allergy testing as well. So again, depending on the cause of the conjunctivitis, treatment will be according to that. So this can include a topical or oral treatment, as well as surgery if it's one of the most serious problems, such as a tumor or any trauma that needs to be corrected, or deformities as well. So topical antibiotic ointments or even eye drops, in the case that it's dry eye, may be given to your dog. So some of these include some of these antibiotics here: gentamicin, tobramycin, oxytetracycline. Not going to try and name all these. Got some crazy names in there. And then also some anti-inflammatory ointments, such as the dexamethasone or prednisone. You may also, your dog may also be prescribed oral antibiotics or anti-inflammatory medications, as well as I said before, if there's any abnormalities or trauma that needs to be corrected, some surgery may be required to correct that. So for prevention, like I said before, if it's a primary or secondary cause, usually if it's a primary cause such as it's just like an irritant or allergy, these are some things that can be prevent it, so you can take some precautionary measures to prevent your dog from getting conjunctivitis. So some of these include keeping your dogs up to date on vaccines, especially distemper. One of the symptoms of distemper is inflammation of the eyes, so that can be lead to conjunctivitis. So you want to make sure specifically your dog is up to date on distemper, as well as distemper is just awful. As well as supervising dogs during play to prevent any trauma and make sure they're not biting or nothing serious happens with your dogs when they're playing with other dogs. As well as, which I'm sure most of us are guilty of, when you have your dog in the car, is letting them stick their head out the window, as this can introduce your dog to debris or anything that may enter their eyes when they stick their head out of the window. So for my dog Ziggy, this actually happened this past May. So what happened was, about 2 or 3 weeks prior to him getting the pink eye, we had took him to my boyfriend's mom's house, and she has a dog as well, and we took them to a park, and they played around. And then about a week later, I got a call from his mom saying that, asking about Ziggy, if he was okay, because she said that her dog had got pink eye, but she also takes her dog to a doggy daycare. So honestly, I'm not sure if maybe they were introduced to it there, or it's just a coincidence my dog ended up getting it, because my dog was fine. When she called, I was like, no, he's fine, he doesn't have anything. And then a week after that, he got pink eye, and I noticed immediately, because he had the abnormal colored discharge, and it was, it's excessive, it's stringy, as well as his eye was red, and it actually only started off in one eye. But I had made an appointment with the vet, and by the next day, it had spread to his other eye. So when I got to the vet, they did an examination, but it wasn't as detailed as I had mentioned, some of that the vet may do before, but I think that's if they suspect that it's more than that. But given his history, and that, I told her everything, how we had visited his mom, and how her dog got the conjunctivitis, so it most likely he probably got it from there. But they just did a general eye examination, and I guess she didn't find anything that was alarming, so she just went ahead and prescribed me this it's an antibiotic as well as a anti-inflammatory ointment. So I had to give this to him for a week, twice a day. So that was the time he had got pink eye. And as well as as far as prevention, I try to wipe his face off when we come in from walks, because he really likes to stick his face into bushes and flowers and stuff. So if that is a cause, if debris or anything gets into his eyes, I just make sure I wipe off his face when we come back from his walks.
On that treatment, you put it right on the eye, right?
Yeah, I have to. It comes in a little tiny tube. Yeah, and I find it easier. I make sure I wash my hands before I do this, but I put it on my pinky, and then I put it on his eye, because he does not let me get near his eye with the tube itself. And plus, I find it a little bit easier to do it that way.
Mm-hmm.
But that's it, and these are my sources.
You can do a loud clap if the dogs are gone. Yeah, okay. Questions, comments? Good.
As I mentioned earlier, I work at the Human Society, and I'm part of the medical team. So conjunctivitis is huge at the clinic.
Mm-hmm.
Usually, it's usually kittens that get it, the cats, the dogs don't really get it. But we use afoxicin, and we use eye drops as well. Eye drops.
Oh yeah.
Okay.
Those are to treat it.
Yeah.
Yeah, there's different treatments, and you always got to make sure, be careful what you put in the eyes, because they're very fragile, and you got to make sure it's for eyes, not just a topical thing that you're going to put in the eyes. Right. It's got to be really specific, because it's got to be really clean, and you know.
Which I found as well, yes, when I was looking this up, eye drops and stuff that they get to you with.
We use the dexamethasone as well, but it's if it's more aggressive.
Yeah, eye drops are a little easier than some cream. But yeah, whatever works.